Disc herniation treatment, spinal decompression, and other treatment options by Dr. John D. Carlson, Austin Chiropractor. Spinal decompression for herniated disc treatment and other treatment options. Hello, I'm Dr. John Carlson, and thanks for joining me here today. Today I'd like to answer the question, what other treatment options are available if I have a herniated, bulging, or protruding disc? Number one, specific exercises. Specific exercises are good to help the muscles of the spine remain strong, and the more your core muscles stay strong, then that can prevent shearing forces upon the disc and help the disc last longer. But let's be certain, specific exercises do not stimulate the internal repair of the disc, and that's a negative for using exercises alone and by themselves. Inversion therapy is a way of which patients can hang upside down by ankle boots attached to a bar and then hang from their ankles and feet. You can also lay on a table with ankle boots around your feet and then gently lean back, and allows you to invert your body. Or there are apparatuses today where you can hang by your thighs and hang upside down from your waist, all which apply traction, all which supply axial traction or decompressive force to the spine, and that is good and that's positive. There are some side effects that are not so good with inversion therapy. Number one, you can't control the amount of force that you put and use upon a disc. That's not really gauged, and it's not necessarily good, and that can be very problematic for you if you have an unstable disc. Also, it's very hard to overcome muscle guarding when you're hanging upside down. Maybe not so much when you're laying on an inversion therapy that's a table kind of apparatus, but still you get into muscle guarding, which makes it difficult to allow the decompression of the disc itself. And then also, it's very difficult of which to make sure that you avoid too much force, and you certainly can't get into a positional preference such as extension or flexion, which is essential as we know in spinal decompression to get a good result. Not knowing your positional preference can lead you to make the disc worse, so be very careful if you're choosing inversion therapy, and make sure that you're under the direction of a doctor to do so. Now, chiropractic adjustments. I've used chiropractic adjustments and I've helped patients for 28 years now to gain relief from disc pain. Well, there are good results that I've gotten, and there are certainly times that we have failed. However, I would say this. Since I have understood and have been using spinal decompression in my practice, I've gotten a quicker result, I've gotten a better result, and the patient spent less time and less money trying to resolve their problem. Well, that's why spinal decompression, I think, is superior to a simple chiropractic adjustment by itself. So epidural steroid injections are another way of which conventional medicine is using this. Epidural steroid injections are where the doctor uses a long needle, pushes it into your spine, into the area of the spine around the spinal cord, right by the disc, and they give you an injection of cortisone, which is a strong anti-inflammatory, which causes the disc to shrink back and diminish in size. Well, that's good, and that certainly can prevent and give a lot of relief. Let's be certain, though, it does nothing to restore the internal integrity of the disc, and seems to be more symptomatic relief giving than restoring of the disc tissue itself. Now, spinal surgery is something that should be entered into with caution. If you have a situation called cauda equina syndrome, where you have severe constipation, or you have loss of your bowel control or bladder control, or inability to urinate, all of those could indicate that you have cauda equina syndrome. That is an emergency situation. You should go to the emergency room immediately, and they will have a neurosurgeon or an orthopedic surgeon decompress the area and get the pressure off the nerves, so those nerves won't be damaged and you won't be stuck with that condition for the rest of your life. However, there's only a few cases that actually have cauda equina syndrome for people who have herniated disc. But if indeed you've tried everything else such as chiropractic adjustments, exercises, spinal decompression, epidural steroid injections, you've eliminated all those things, then spinal surgery may be necessary. And when you do, a second opinion is a good option to take, and make sure you understand what the doctor is going to do, how he's going to do it, and what he hopes to accomplish, what the good side's going to be and what the bad side's going to be. But if we can get a good result with conservative treatment, let's start off with more conservative care and let's move to the more radical and invasive care, and that would be the best chance you have, so that you wouldn't have, if you didn't have a good result with spinal surgery, you would not come back and say, well, I wished I could have done this earlier. Well, those are all things that you can do for other treatment options besides spinal decompression. But if you have a herniated disc, I want to encourage you to try spinal decompression. It's likely effective to help you. It's FDA cleared for the treatment of lower back pain and relief of leg pain. So if you're having a herniated disc in your neck or in your lower back, get in and try to find someone to help you decompress that disc and allow it to get repaired. Remember, spinal decompression not only helps you feel better, but it helps restore and repair your original GM parts. Hey, I'm Dr. John Carlson. Thanks for joining me here today. I hope I've answered the question, what other treatment options are available for herniated, bulging, and protruding disc? I hope to see you again soon, and when I do, I hope to find you healthy and living life to its fullest.
You can also visit me on my blog at www.drjohndcarlson.com, where you'll find more information and cost-saving internet specials.